Introducing you to our Lipo Lax Plus and Lipo Lax V-line fat dissolving solutions, an innovative fat burning formula based on the process of lipolysis. Obtaining a slim figure without cellulite and excess weight is a challenge for most people. A sedentary lifestyle, improper diet, and metabolic disorders lead to the formation of fat deposits and the notorious orange peel, making it difficult for people to achieve their ideal physical bodies. Modern pharmacology offers lipolytics, substances that can hydrolyze fatty deposits. The effects of Lipo Lax Plus are driven by lipolysis, a process that results in the cleavage of one molecule of triglycerol, the substance that makes up an adipocyte or fat cell, into 3 molecules of fatty acid and 1 molecule of glycerol. This splitting occurs with the help of injections, which upon entering the fatty tissue cause the release of fat from the adipocytes. One of the main causes of obesity is the excessive lipid synthesis over the processes of their digestion. In this case, the excess fat remains in the body and accumulates in the subcutaneous fat between muscle fibers and on vessel walls. Lipo Lax Plus combats these deposits. Lipolytics and mesotherapy has its own benefits. Anesthesia is not required for the treatment. It's simple, it's effective, and it's convenient. Dissolves and destroys fat cells. It's effective against cellulite. It quickly removes the fat deposits in parts of the body that cannot be reduced with physical exercise or diet. It guarantees a safe treatment due to the highest purity of raw materials, maximizes the effectiveness of lipolysis. Lipo Lax Plus has its own treatment areas. You can inject it to the chin area, to the abdomen, to the lateral folds, to the inner thighs and knees, to the shoulders and back, to the back of the hands, to the contours of the hips and buttocks. After just one session of lipolytic mesotherapy with Lipo Lax Plus, unwanted local fatty deposits can be removed along with cellulite and flabby skin. After the 3rd session, injection areas will have noticeably decreased. Local accumulations of adipose tissue in problem areas, ears, thighs, sides, second chin, etc. have disappeared, and the skin in the treated areas has become smoother and elastic. Before the treatment, the doctor should conduct an initial patient assessment to collect prior medical history and determine treatment areas in order to establish the most ideal and adequate protocol for the patient. During the treatment, use the thinnest single-use needle to inject Lipo Lax Plus into the subcutaneous fat layer of the treatment areas. After the treatment, the patient should combine a well-balanced diet and regular exercise to achieve the desired results.
Ну, можете приподняться. И что именно вам не нравится?
So the doctor is asking the patient what is he complaining about.
Здесь на самом деле нет такого объема подкожировой клетчатки. Смотрите, да, околопупочная область, нижний отдел.
So it's the lower side of the lower
Это единственное
belly.
место, где у него можно колоть липолитики.
It's the only place where we can inject lipolytics for this client.
я буду равномерно распределять. Если препарат буду колоть Lipo Lax, да, если бы был объем большой героя клетчатки, то каждые 2 квадратных сантиметра. То есть это вот таким образом.
If I would be using Lipo Lax, I would be injecting the product in each square centimeter. I will make micro doses more often.
По 0,1, да, на каждый вкол.
0.1 for each perforation.
Все, можете ложиться. Это тоже до этого было?
Нет, это было обычно.
Обычно, да? Ну, да, оставьте. Я беру 30G иглу.
I take the needle 30G size.
Ну и классическим методом щипок буду брать ткани.
And I form a fold, and with the classic method, I make a perforation
И микродозы,
and inject microdoses,
но часто.
but often.
Is that a 13 millimeter
Сильно больно?
needle? Is that a 13 millimeter needle?
Какая еще раз толщина иглы?
30G
30G.
на 13 на 12.
Length of the needle.
А длина?
13 millimeter?
13-12 миллиметров.
13 per 12.
А кто-то спрашивал про болезненность. Ну, вот пациента спросил, говорит, что ему не больно.
Someone asked if it's painful procedure, and I just asked the patient, and he said it's not painful.
Я думаю, что 2,5 миллилитров хватит.
I think 2.5 milliliters is enough.
Когда работаем с лицом, да.
When we work with the face,
Конечно же, я просто так не буду колоть, ну, как бы на глаз.
I will not just make injections like that, how I just did.
Я сначала сделаю разметку,
Because before that, I will paint the lines,
просчитаю каждый вкол
count where will be each perforation,
и таким образом подберу дозу.
and by doing that, I will find the suitable
С
dose.
расчета, что на один вкол от 0,1 до 0,2 миллилитров.
So in that case, one injection will be 1.1 to 1.2 milliliters
На каждый квадратный
per each
сантиметр.
square centimeter. 0.1.
0,1, 0,2.
0.1 or 0.2.
Все. Процедура была еще проще.
This procedure was even easier than the previous one.
Okay, do we have any questions on that procedure, anybody?
Может быть, какие-то вопросы по этой процедуре?